5 medical tests you might want to skip after turning 70, because they can sometimes do more harm than good. There's a hidden reality that most older adults are never told by their doctors. Each year, millions of seniors go in for routine checkups, believing they're staying healthy. But what if I told you that some of these very tests, ones your doctor recommends, might actually lead to surgeries, strokes, or even cancer? Recent research shows that as many as 37% of tests in people over 70 result in unnecessary treatments, harmful complications, or side effects that last a lifetime. Even more surprising, 99% of seniors don't know that they might be getting tested too much. One of these tests, number 1 on our list, is actually linked to 5% of all cancer cases in the United States. That's the same number of cases caused by drinking alcohol every day. You won't hear this at your local clinic. You won't find it on a health poster. But the real truth is hidden in medical research. And today, we're revealing everything. In this video, we'll show you the 5 medical checkups to avoid after 70 and the shocking facts about what these tests can really do to your body. Everything is backed by real science, and you'll be surprised by what takes the second spot. Before we get into it, tell us in the comments where you're watching from, how old you are, and if you've ever regretted a test or medical treatment. Do you feel like older people are being tested too often? We're reading every comment and replying with helpful advice. Also, make sure to like this video and subscribe to our channel for more health updates. Now let's start with the first test, one that seems simple but could quietly lower your quality of life. Number 5, the bone density scan. It sounds innocent. A quick scan, no pain, no injections, and it tells you if your bones are at risk of breaking. But here's what you don't usually hear after age 70. A bone density scan might do more harm than good by creating fear and unnecessary treatment. The scan, officially called a DEXA scan, checks how dense or strong your bones are. It's mainly used to find osteoporosis, but in older people, especially women, the results often come back showing lower bone density even when there's no real danger. That's because losing some bone mass is a natural part of aging. Just like wrinkles or gray hair, it happens to nearly everyone. But even so, many older adults end up being told to take drugs called bisphosphonates medications that are meant to make bones stronger. However, these drugs can cause serious problems like jawbone decay called jaw necrosis and irritation of the food pipe esophagus. Here's the issue. Studies have shown that treating mild bone thinning in people over 70 with these drugs barely changes their chance of breaking a bone. One study in the Journal of the American Geriatric Society followed more than 1,200 women over 70 and found that the drug reduced fractures by only 0.3% over 5 years. That's something, but it's not life-changing. Meanwhile, these women were more likely to suffer from drug side effects like stomach issues, throat inflammation, and even fragile bones that broke in unusual ways. Take Rose, for example. She's a 76-year-old retired piano teacher who had a DEXA scan after her yearly exam. She never had any falls, didn't feel pain, and walked daily. Her skin showed osteopenia, mild bone loss that isn't considered dangerous. Still, her doctor put her on a medication called alendronate, a type of bisphosphonate. Just 3 months later, she started having bad acid reflux and pain in her jaw. When we saw her, she hadn't touched her piano in weeks. We stopped the medication and gave her vitamin D, resistance exercises, and a diet rich in calcium with foods like sardines and leafy greens. A year later, she was back to performing with stronger legs, better balance, and no broken bones. So, while a bone scan might sound helpful, for people over 70 who aren't falling or breaking bones, focusing on lifestyle changes may be the smarter route. Strength training, balance practice, a good diet, and fixing vitamin D deficiency have been proven to cut fracture risk by over 20%, according to a 2022 study in Osteoporosis International. Don't let a skin number pressure you into taking medicine you may not need. But there's another scan that can lead to something even more serious: brain surgery. Let's talk about that now. Number 4, brain MRI for memory problems. When seniors begin forgetting more or feeling confused, it's normal to feel scared. People fear dementia or Alzheimer's. Doctors often respond by ordering a brain MRI. But here's the uncomfortable fact. MR is detailed images of your brain rarely show anything. That actually explains memory issues in older adults. Most MRs in people over 70 only reveal normal signs of aging like mild shrinking or small white spots that don't mean anything dangerous. But the moment these spots are found, they can cause a chain reaction of worry, extra tests, or even surgeries. And those surgeries may not help at all. They can even make things worse. In 2021, Neurology Today published a study that reviewed over 3,000 MRs of people aged 70 to 85 who had mild memory complaints. About 86% showed some type of brain change, but only 3% of those were tied to something treatable. This means 97% of people were told something looked wrong when it wasn't dangerous. Worse still, around 12% ended up getting spinal taps or brain tissue biopsies based on unclear results. That's what happened to George, a 74-year-old retired engineer. He worried about forgetting names and losing his keys more often. His doctor ordered a brain MRI, which showed white matter changes. George panicked, thinking he had early dementia. He quit driving and stopped going to church. His anxiety got worse. But when we gave him a basic paper memory test, he scored completely normal. We explained his MRI results were typical for his age. We helped him work on sleep, drinking enough water, and doing brain exercises. In 3 months, his memory returned to normal and he felt like himself again. Unless someone has serious symptoms like seizures, sudden personality shifts, or rapid mental decline, an MRI usually isn't helpful for mild memory issues. A better first step is a cognitive test, a simple written exam that checks memory, focus, and thinking skills. It's low cost, works well, and avoids unnecessary fear. Now, get ready because the next test is something almost every senior has had. And it's number 3 for a big reason. Number 3, cardiac stress test. This is one of the most common tests given to older adults who mention they're tired, have chest tightness, or feel weaker than before. A cardiac stress test checks your heart while you walk on a treadmill, or are given a medicine to simulate exercise. It's used to find blocked arteries. But after 70, if you don't have clear signs of heart disease, this test can be risky. That's because it often leads to false results and unnecessary heart treatments. The problem is the accuracy of the test. Studies show that in people over 70, the stress test can give a false positive saying something's wrong, when it's not up to 40% of the time. That leads to more tests, like inserting a tube into the heart angiogram, and sometimes unneeded surgeries like putting in stents or doing a bypass. A big 2017 study in JAMA Cardiology found that more than half of heart stents placed after stress tests were done in people who didn't have real symptoms or benefit. These people didn't live longer or feel better after the procedure, but they did have more bleeding, kidney damage from the test dyes, and longer hospital stays. Raymond, a 75-year-old retired mailman, went through this. He walked daily, but said hills made him tired. His doctor ordered a stress test just to be safe. The results weren't clear, so he was sent for a heart catheter test. It found a slight blockage, so a stent was added. But that night, Raymond reacted badly to the dye and developed kidney issues. He stayed in the hospital for 6 days and needed weeks of follow-up care. His tiredness didn't go away because it wasn't his heart causing it. He just needed more fluids and rest. If you're over 70 and not having clear symptoms like chest pain during activity, shortness of breath when walking, or very low energy, then a stress test might do more harm than good. Better options include a resting EKG, a heart rhythm test while sitting still, or a coronary calcium scan, which shows plaque buildup with very little radiation. These are safer, simpler, and less likely to lead to unneeded procedures. Number 2, colonoscopy. You may not have expected this one. A colonoscopy uses a camera to look inside the colon, usually to check for cancer. But after age 70, and especially after 75, it's often not the best idea unless you have specific symptoms. The risks go up with age. The prep for the procedure uses strong laxatives that can cause dehydration, dizziness, or even kidney problems. The anesthesia sedation used during the test can affect memory or brain function in older people, and the test itself can sometimes cause bleeding, tears in the colon, or abnormal heart rhythms. A 2019 study in JAMA Internal Medicine looked at over 1.3 million Medicare patients aged 70 and up. For every 1,000 colonoscopies done on people over 75, only 2 lives were saved, but more than 20 people had serious side effects. That's 10 times more harm than benefit, and many of the growths found are small and slow-growing. Removing them in older adults can sometimes be worse than leaving them alone. Dana, a 73-year-old grandmother who ran a bakery, had no symptoms, no bleeding, and no family history of colon cancer. But her new young doctor insisted she get screened. She agreed. A small polyp was removed, and she was sent home. That night, she had strong stomach pain and passed out. At the hospital, they discovered her colon had been torn. She spent 9 days recovering, lost weight, and felt weaker for months. It turned out she'd already had to clean colonoscopies in the past. There was no need to repeat the test. The U.S. Preventive Services Task Force advises stopping routine colon cancer screening at age 75 for most people. If you're healthy and want to screen, consider the FIT test-a-stool test done at home that's safer, doesn't need prep, and catches most serious cases. Once you start down the colonoscopy path, it can be hard to stop. And now we're at number 1, the most common, dangerous, and overused test for seniors: full-body CT scans. These scans are often sold as part of private executive checkups to find cancer early. But here's the scary truth. They expose you to high levels of radiation. For people over 70, they often lead to more scans, biopsies, or surgeries that you might not have needed. And here's the shocking part: there's no proof these full-body scans save lives in healthy people. Each one gives off radiation equal to 500 chest X-rays. A 2023 study in JAMA Internal Medicine suggests that the rise in CT scans might now be causing up to 5% of all cancers, about the same number caused by daily alcohol use. That means 1 in 20 cancers could be from scans that were supposed to prevent disease, and that's frightening. These scans often find tiny harmless things like calcium spots or small lumps that are part of normal aging. But once seen, they trigger more tests, more stress, and sometimes painful procedures. Marcus, an 80-year-old who taught martial arts, felt healthy and took part in a premium checkup at a private clinic. His full-body scan showed a 3 mm lung spot. He was sent to a cancer doctor, had a PET scan, and later a biopsy. It was harmless, but the biopsy caused part of his lung to collapse. He had to stay in the hospital for weeks and couldn't train during recovery. All of that could have been avoided. Experts now say full-body scans should never be used for screening healthy people. The American College of Radiology warns there's no clear benefit, but many ways it can go wrong. If you have symptoms like unexplained weight loss, coughing, blood, or swelling, targeted scans may help. But scanning the whole body without a reason is like looking for treasure in a minefield. You might find something, but it could cause more damage. A smarter choice is to pay attention to how you feel. If you feel okay, stick with basic doctor visits and only do tests you truly need. Your time, your energy, and your health matter too much to risk on tests driven by fear. So there you have it: 5 checkups that can hurt more than help once you're past 70. Medicine can do a lot of good, but it's not perfect. Sometimes doing less is actually better. Always ask yourself, what will happen if this test finds something? If the answer isn't clear or if the risks seem too high, it's okay to say no. Real prevention comes from healthy habits. Stay active, eat nutritious food, get good sleep, and choose your tests carefully. Now, we'd love to hear from you. Has a test or treatment ever caused trouble for you or someone you care about? What was the experience? Share your story in the comments below. We'd love to know. Thanks for watching.